causing more deaths each year than vehicle accidents, gun-related deaths, and alcohol-related deaths combined. Tobacco continues to be the consistent killer in the U.S. We will look into health risks of so many Americans through the use of tobacco products. In 2016, an estimated 15.5% of U.S. adults were current cigarette smokers. 76% of that number smoked every day. This number is presumed to be 2 to 3 packs a day. Seeing that our knowledge on tobacco health risks are greater than ever, why is it such a problem in our communities? Michael Carey at the Clinical Department of the Alcohol and Drug Abuse Council, who was also a former tobacco user, explains deeper into the problem.
It is a very big problem here in the East Texas area, mainly because of, well, there's a plethora of reasons as to why, but it's just culturally, it just seems like it's culturally accepted here. Maybe some cultures, it's like a rite of passage. To be able to smoke, you have, arrived into adulthood. So that's kind of that misconception, or just that cultural norm that happens.
Getting off of tobacco can be hard even for an abuse therapist.
I used to smoke cigarettes up to 2 packs a day. And from experience, I can tell you that it was a hard substance for me to kick. Because of that constant craving.
Tobacco companies let consumers know the risks of using tobacco, yet people are still hooked.
So we educate. I think that's the most important aspect, is to educate. People know that it's bad for them, but not a whole lot of people truly understand what's in the tobacco. Right. That there's over 7,000 known chemicals and found in just a cigarette itself. Not to mention 70 of those have been known to be carcinogens or to cause cancer. So we take the educational approach here.
Tobacco is not an instant killer. It's slow but lethal. Dr. James Cacciatolo gives us a better insight on how it affects the anatomy and physiology of our bodies.
So obviously, tobacco smoke has a lot of different elements to it, and it can affect people differently, but the main thing that it does is it affects ciliary function of the bronchial tubes. So the airways are lined with cells that have little cilia, and they beat and they move mucus up and out of the airways. That's a normal sort of protective mechanism. And cigarette smoke damages that process. So patients tend to have a lot of sputum or mucus in their lungs, creates a lot of cough, and then that can lead to other problems like pneumonia. Over the long term, it can also cause bronchial constriction, sort of thickening of the muscles in the airways, and ultimately it leads to the development of emphysema.
In conducting an experiment to show the effects of tobacco on the respiratory system, we simulate smoking a cigarette, allowing perfectly white cotton balls to represent our lung tissue. Slightly squeezing the bottle allows the simulation of breathing in tobacco smoke. This over time will collect and settle on the lung tissue, creating problems just like Dr. James Cacciatolo mentioned. After just half a pack of cigarettes, we can already see the vile effects of cigarettes. This tar-like buildup damages the transportation system of the respiratory system for oxygen and CO2 release. After about 3 packs maximum, the cotton balls will eventually be almost completely blackened.
About 30% of patients who have a heart attack, it's usually tobacco related, and probably well more than 90% of the patients that I operate on for lung cancer are related to tobacco use. So the vast majority of people that need surgery for either heart or lung disease are, somehow related to their use of tobacco. So it's a tremendous impact on my practice as a thoracic surgeon.
Speaking with Dr. Robert Polwan of the Psychology Department at Stephen F. Austin State University, we get an insight on the mental effects.
Nicotine addiction, nicotine addiction is very powerful because, only about 1 in 10 people will break the habit of nicotine addiction. And, it's always, where do we see that next cigarette is their question. They're always thinking about it when they're not smoking. It has negative effects like on health, causes cancer, It causes higher blood pressure, causes, long abuse, will also cause stress, particularly without your next cigarette, which will cause the release of other hormones that help to destroy different areas of the body, like the immune system.
The Health Center at Stephen F. Austin State University allows current tobacco users to attend sessions for therapeutic help with getting off the addictive drug. SFA is a no tobacco zone mainly due to the concerns with college student health. Although we've seen a decline in tobacco usage in the past decade, it continues to be a major killer here in the U.S. If you want more information on tobacco statistics in the United States, or specifically in your area, you can go to cdc.gov. If you're having trouble quitting tobacco, you can call 1-800-QUIT-NOW. That's 1-800-QUIT-NOW if you'd like to quit using tobacco and are having trouble doing so. For East Texas Explorer, I'm Luke Hamilton.